Well, the aim of and the role of the continuing promise exercise is quite multifaceted. First off, it's to provide humanitarian relief to a variety of Caribbean countries. Now, it's very difficult to sort of go in for 2 weeks and provide any sort of medical treatment that's effective, but I think, in fact, these patients do wait sometimes a year to see our teams come in, and we're getting a lot of questions on chronic medical illnesses that they've sort of saved up for us. So the role is both to provide medical treatment and medical opinions to these patients, as well to promote sort of a goodwill between the various countries and the U.S. and Canada and the other participating countries, Brazil and Holland, in the Continuing Promise. My role during this Continuous Promise exercise is to augment the existing resources in Trinidad. So at CUVA here we have an emergency room that's fully staffed and fully working, but to help them out, I've been spending every day with the unit's been here, integrating with them and providing additional care, both consultative to some of their practices. They ask me questions on what we would do differently in Canada, and the same. I've been learning a lot from them and in that how they treat certain infectious diseases that we don't see. So it's sort of a mutual exchange of information, but to assist them in helping out in the emergency department here. The way that Canada has sort of helped out with Continuing Promise, it's a 4-month exercise for humanitarian relief in the entire Caribbean. Cooperation between all the different Allied soldiers that have been involved in this mission has been absolutely excellent. We've Canadian soldiers and fit in very well with the entire team, providing a variety of services in all aspects. So we've rotated around to the different sites that we're providing care in and fit in as physicians or nurses, doing registration, checking blood pressures, doing a variety of things, and we've integrated very well. We've learned lots from the American counterparts, and I think they've learned stuff from us and how we do things in our organization. So it's been a useful exchange of information right from the beginning of this exercise.
It's very important that we remember that this is not just a U.S. mission. Obviously, the Kearsarge is a U.S. ship, but it is an Allied mission. We have several different countries that work with us. Of course, Canada has sent a large contingent to work with us, as well as the Netherlands and Brazil. France also partnered with us in the Dominican Republic. And it's not just military. We have the United States Public Health Service working with us, as well as we've had 3 non-governmental organizations, NGOs. Canada has been a vital partner in this effort. There have been 13 to 15 Canadian officers and enlisted folks with us from the get-go. Went in 3 different legs. Each leg stayed with us for 2 countries. And the skill sets were very broad, from administrative skills to dental skills, to medical skills, to nursing skills, just a very broad scope of skills that were very, very critical to the mission. And perhaps even more than the skills was the spirit that the Canadian team brought. Each time one of the Canadian teams left, we thought, oh gosh, the next team can't possibly be as good as them, and the next team comes, and sure enough, they are. One of the best quotes to describe that spirit to me, when the first Canadian team left, one of my U.S. counterparts leaned to me and says, "There goes a lot of happiness from the mission." And it was true. They brought a very special spirit, hard work, but do it with a great, happy attitude. But the next team came in and picked that ball up and did exactly the same thing. So it's been very, very positive, not only just on the skill level, but on the interpersonal level and the mission accomplishment level. I couldn't have been more pleased.
Well, I think the Operation Continuing Promise is an excellent venue that's been now going on a couple of years now, and I think they plan to continue it in the future. And I think it's very important that Canada play a role in participating in these humanitarian aid missions. We've been involved with peacekeeping and now in war efforts in Afghanistan, but as well we need to be seen as promoters of world health and world peace. But the fringe benefits to our country and the esprit de corps and the benefits that we receive from just participating in the exercise is unmeasurable. So I think that's the big message, that Canada needs to keep participating in humanitarian efforts like this. It's very well received. it does a lot of good for the image of Canada to be involved in the host nations and participating in events like this.